Hi, Dr. Jeff Bowne here, and we're going to talk about non-surgical spinal decompression. Now, non-surgical spinal decompression is a relatively new technology that's been designed to treat severe low back pain associated with sciatica, degenerative disc disease, disc herniation, spinal stenosis, facet syndrome, etc. Now, most patients undergoing non-surgical spinal decompression have had unrelenting low back pain and sciatica that's been non-responsive to some of the traditional or conservative treatment methods available, like chiropractic or physical therapy, medications. Some patients have even had cortisone injections or epidural injections. And I even had patients in the office that have had spinal surgery that have had limited or no results after their surgery. Now, with that said, not everyone's a candidate for non-surgical spinal decompression, and each patient will undergo a very detailed and comprehensive examination to determine if this treatment method is safe and effective for them. Now, what I have over my shoulder is an illustration of what happens when a disc begins to break down and the symptoms associated with that, and how non-surgical spinal decompression may be a solution to help alleviate some of those symptoms. So, if you pan over here and take a look, what we're looking at is an illustration of a disc looking top down. And this light gray area here represents the outer shell or hard shell of the disc that provides strength to the disc. And this dark gray area in the center is a jelly-like substance that helps provide shock absorption properties. Now, together what they do is they allow the ability of the body to absorb and dissipate the compressive forces that we have throughout life and the wear and tear throughout life, as well as trauma. Now, when those traumas or that wear and tear becomes too much for the disc to handle, the disc begins to break down and begins to fail. So as I illustrate the beginning stages here, you can see that initially what happens is there's a slight fissure or a tear in the disc. Now, when that happens, it's a very painful process because this outer 1/3 of the disc has many nerves there. So when those nerves become irritated or disrupted, it's pretty painful and uncomfortable. And as this process begins to advance, that dark gray area, or the jelly-like substance, seeks out that crack and begins to put pressure onto the surrounding nerves. Now, when these spinal nerves are impinged or irritated, we get symptoms like paresthesias, or what that means is numbness and tingling or lack of sensation into the extremity or into the foot. We also can experience some level of weakness. Sometimes we have diminished reflexes, and when those things happen, this becomes a pretty severe disc pathology. Now, what spinal decompression or non-surgical spinal decompression is designed to do is to help alleviate that symptom by removing the compressive forces that are onto the disc that have caused some of those problems. Now, if we can reverse or alleviate that compressive force, oftentimes we'll get pretty significant or dramatic results in symptom relief. Now, when seeking a non-surgical spinal decompression solution, we recommend that you find a doctor that is utilizing the DRX 9000. And we say this because it's a very sophisticated and robust system, and it's probably the most sophisticated system available to administer this type of treatment. So, if you've been experiencing low back conditions or low back pain that's been non-responsive to some of those treatment methods, consult with your chiropractor or your physician to see if this may be an option for you. So if we happen to see you in the office, maybe this will be the solution, and maybe we'll get you back on the road to recovery.